Hello, welcome to the Let's Talk Kids Health Facebook Live show, episode 33. I'm Dr. Narissa Bauer, your host. I'm a behavioral pediatrician and blogger of Let's Talk Kids Health. As you know, the concept of this show is to share information about behavioral health, parenting, and family wellness. Each week, I plan to bring you topics and guests so that we can all advance this mission and talk together. Now, let us know you're here by posting comments and likes. And as always, the replay will be immediately available after this broadcast. So please share the episode with anyone you think would benefit. Now, if you don't want to miss future episodes or maybe check out the past ones, please subscribe to my YouTube channel, Narissa Bauer MD, and follow my blog Facebook page, Let's Talk Kids Health. Okay, so now to this week's guest. Let's welcome Dr. Daniel Hochman. Dr. Hochman is a psychiatrist who believes in addressing underlying issues. He supervises at the University of Texas Dell Medical School and has a private practice where he treats addiction cases that have not fully responded to other forms of treatment. As a leader in the addiction field, Dr. Hochman has been invited to train and speak for a range of organizations, including Whole Foods and ongoing media appearances. He created a unique addiction recovery program called Self Recovery that is entirely online, private, and empowers people to solve their addiction puzzle. I am so excited to welcome you to the show, Dr. Hochman.
Thanks for having me, Narissa.
Yeah, thank you so much for joining me today. So, I'm really glad to have you on. You're actually the first of two speakers back to back to talk about this important topic. And so I just thought maybe to start and set the stage, we just start with the easy question. What is addiction and how does it develop? That way, everybody watching and viewing this, we're all on the same page together.
Yeah, good. That's a good place to start because addiction is interpreted differently depending on who you are, what role you're in, or what you believe in. So, addiction, clinically speaking, has 11 criteria, and you have to satisfy at least two of them. So there's mild, moderate, severe, and so there's a bunch of criteria, including things you would expect. So, are there consequences? So, like consequences to relationships or your body. Used to be legal things, consequences of like a tolerance, so you need more and more of it over time, that you experience a withdrawal, so stuff like that. So there are criteria, and if you meet enough of them, you have a form of addiction, or a substance use disorder is the more technical term diagnostically. So we don't say addiction in a medical chart. Now, having said that, addiction, as we normally use the word, could mean all kinds of things, right? We say we're addicted to food, addicted to love, addicted to drugs. So I actually don't mind that looser definition. The way I like to define addiction, for that I think is a more useful way to think of it for most people, is that it's a reliance on something outside of you to take care of underlying distress. So you're going outside of yourself to regulate.
Mm-hmm.
And
Yeah.
that could be something super harmful, or it could be something only mildly harmful.
Okay. I think that's an important distinction too. Just because I can especially imagine, and I wonder, I'm going to just ask you this, given kind of the past year and a half that we've been living through with the pressures of the pandemic and the stresses that we're all facing as a global community, have you seen increases in addiction, as you define it, in your practice?
For sure. So yeah, increase for sure in the loose sense, but also strictly speaking, according to diagnostic criteria. I do know offhand the numbers on overdoses, I think, went up to around 92,000 in 2020, and that was up from, I think, like 70,000 or something like that. So that was a huge, huge bump that we saw with COVID for overdoses, but we saw an analogous increase just in, addiction as well, people not overdosing necessarily. So yeah, lots of people just don't know what to do with themselves. They're going, crazy with the amount of extra workload, doing it remotely. It's a mess at home, all that stuff. Not really good, healthy outlets because you can't go do normal things. So absolutely, it's taken a terrible toll.
Right. And are you seeing a particular increase in a certain type of substance that folks are using?
That's been more or less consistent, I'd say. People who were abusing alcohol or people who were abusing painkillers or looser sense, just binge watching shows and stuff. It typically then we turn to our familiar vices
Yeah.
in our weaker moments or when we're under more stress. So
Hmm.
not necessarily a huge change in what people are doing.
Yeah, I just found it interesting that you said binge watching because I think
Mhm.
that one has definitely really gone up, especially in my own population for kids. Now, I'm a pediatric physician, right?
Yeah.
But a lot of screen time use and a lot of challenges around regulating screens, not just for kids, but for families in general.
Yeah, yeah. So it's the shows, it's the scrolling, right? All these kids, they just they got strong thumbs, and so the scrolling, the video games, all that stuff. It's eating us alive.
Yeah, it really is. I mean, and so because I think my audience, a lot of them are parents and a lot of them are pediatric providers. What tips would you have for parents to actually talk to their child about addiction?
Where I see it often go wrong, I'll just start there and then
Hmm.
offer the answer for that is often it's way too focused on the object of addiction. So say you've got a teenager and they've experimented with weed or they've had too much to drink or something, whichever of those. Um, the mistake I often see is it's just entirely focused on you drank too much. That was stupid, bad. Not necessarily that people come right out and say that, but along the lines of, bad drug use, bad alcohol. And and so it's hard because it's tempting as a parent, like you want to correct that and make sure they know like that was bad, it's dangerous, this wasn't safe, it's bad direction. So that's all true, but remember, whatever we say, we have to remember, well, what's our goal? And so what are the best things we can say to reach the goal? It's not necessarily um, and that becomes less obvious then. So it might feel like, well, just tell them not to do that thing anymore. But so what I do recommend doing instead is trying to address where they were coming from and really offering support for something for a larger vision. So an example, say, of a teenage daughter that experimented too much with something, it would be to try and relate to, okay, you were with your friends, what was it like if they were pressuring you, or maybe it was maybe there's just an excitement to experiment with something in general and change your state of mind, to support that idea, right? But can we do it in other ways, please? Can you know or but most commonly it's going to be because not just a one-time experimentation, but if it's ongoing, where you'd start to really call it an addiction and not just one party they went to with friends, it's going to be because there's underlying suffering. So like
Hmm.
they're going to feel pressure with grades, or they're going through a breakup or a change in their friend group. Someone didn't like them so much anymore, stuff like that, right? Kids are dealing with social issues almost always. That's what's bothering them. So it's either going to be, often pressure in the home, or it's going to be not feeling as accepted, with peers. And so that's what you want to really bring it to. Okay, bad idea with the alcohol, but I can see stuff's been going on for you. Like, can we help you in other ways? Because that's maybe what was happening here. So that's what we want to steer the conversation towards always, is the underlying suffering. If you focus too much on that last part, the child's left thinking, hello, you've been driving me crazy at home, or hello, my boyfriend broke up with me, or this friend doesn't talk to me anymore. Like, they're left feeling like you just totally don't see what's happening with them.
Right. Right. I mean, I love that. I think when it sort of made me think about when I first see patients for the first time and we have to sort of kind of unpack what the issue is, whatever behavior problem they're coming in to see me with, I often tell parents and other providers when we're looking at this is that we think about a tree and we have to really look at the roots. What's the underlying issue here? I mean, obviously, parents' first reaction is to sort of kind of be like, oh my gosh, you just did this because, we are, we want to protect our children.
Yeah.
It's out of that love and that safety kind of feeling. However, it can really cause kids to shut down, and that's counterproductive. So I really love what you just said there.
Yeah, yeah, you're exactly right. It can compound if they already feel pressure at home or if they already feel badly about who they are
Hmm.
socially, and now you're telling them you're going to punish them more so they can't go see the couple friends that were nice to them, as they were going through something tough. Or if you're already hard on them at home, and now you're even harder on them, you're kind of doubling down sometimes on what's already not going well. So, it does require being creative there, being
Hmm.
patient.
Yeah. And I guess, I love that when we started this discussion, you sort of defined kind of the spectrum of addiction, right? And from loose to, the full on disorder. If a parent is suspecting some issue, I mean, when in that timeline should a parent intervene?
Yeah. So in keeping with how I think a conversation is
Hmm.
most constructive, where we're both talking about, the roots, right? The
Right.
underlying issues. To me, it's not about, well, let's wait until it feels like our daughter's really drinking too much, or let's wait until she really does something out of hand, or until it looks like she's actually hooked on something. To me, it's less about that, and more just about if it looks like there's something going on in her life and she's depressed, or she's looking just like a poor nervous girl every day, or insecure, you know that's when you go get help. You don't. I wouldn't wait until there's any number of symptoms or criteria met, and that treatment hopefully is not only geared towards asking every single time just how much weed they've smoked, but instead only using that as a window to understand just how badly they're needing to escape their feelings.
Hmm.
So it should be talked about, and especially when things are dangerous, there are some things that need to be addressed there, but it shouldn't be the sole focus of a treatment. And therefore, a treatment should be, and a good place to start often is just with a therapist, um, without necessarily going to get medication or going to see someone like me, a psychiatrist, just going to see a therapist to deal with life issues as
Hmm.
quickly as possible.
Right. I love that. I think just empowering families to know that there is help out there and a lot of different forms of help. And I guess you had mentioned depression. That could be one cause of these issues. Are there any other things that you think of or need to rule out, when we're dealing with a teenager who has possible addiction issues?
Yeah, it's going to be generally either a home environment that's got to get fixed.
Hmm.
So that's why I mentioned the pressuring. If you're a parent watching this, you're obviously someone who's caring, right? You're already making time and pausing and going out of your way to figure out, well, how do I parent well? So you're probably not the kind of parent that's neglectful or very abusive or things like that. And that's why I mentioned then, the most common scenario is not that there's a lot of abuse driving it and stuff. It's just a little bit too much pressure because we want our kid to do well, right? You and I are doctors. Like we want our kid to like be well educated, get good grades. Let's go places, and but we all do that, right? Anybody who cares about education or just having a good, responsible life. So it's seemingly innocent, right? But a little too much pressure, and then outside the home, yeah, the most common thing is just not feeling very secure in their friend group.
Hmm.
So you'll see, one event change, so like a breakup, or they move classes or move something, and if they don't have a good, secure sense of belonging with their friends, then there's not much to hold them together when that happens. Because they can get through a breakup just fine if they've got their 5 awesome buddies and, life is good. They're still feeling fine. It's when there's not much else sort of to keep them okay, and that sense of belonging isn't there. So that's something to look for. Now, you can call that depression when you feel like you don't belong. It's also an anxious feeling when you don't know what people think of you. But underneath that, you also don't even feel like anybody's giving you feedback and reassurance that you're awesome, or you're beautiful, or you're smart, or you're likable. So, depression and anxiety, those are good general mood disorders to be thinking about. But I'm telling you what I am because it's not enough to just say they're depressed or anxious. To offer them real help as a parent, or for a therapist to do their job, is to look beneath that diagnostic term, or the mood disorder, and see there's something happening.
Mm-hmm. Yeah. And sometimes what's happening are just poor coping strategies, which could lead to some of these new addictions and things like that as well, that we need to be looking for.
That's right. So, I mean, essentially, one way to think of addiction is that there's something going on, say, depression, anxiety, with something going on in life, and it could be something very chronic going on. But in addition to that, because if that's all it is, then you're just left with a depressed or anxious child. But with addiction, in addition to that, it's like you say, there's poor coping strategies. So they're turning to something for a quick fix, which could be alcohol, drugs, something. Whereas if you're healthy, then even if you get depressed, you're having conversations with your close friends or family, or if you're anxious, you're trying to problem solve, right? So there are healthy ways of dealing with our bad feelings, but with addiction, it's typically that it's a very limited shortcut sorts of things that person's turning to.
Right. And I know that the focus here is what we were just talking about, but if I may, because I have you here on the show, I've been thinking a lot about the reverse. What if a parent themselves is dealing with an addiction?
Yeah.
And we know that, the science is showing that adverse childhood experiences, or ACEs, obviously those types of things that kids are exposed to can have lifelong consequences. And we're here about just talking about what's happening in family life to promote family wellness. What if
Yeah.
a family or a parent is watching who is struggling with their own addiction, knowing that, they want to sort of get some help and maybe talk to their child about, what's been happening. Do you
Yeah.
have any other tips on for that angle?
Oh yeah, and that's extremely common, like you say. It's often not really genetic per se, but
Mhm.
just environmental. Where if the home is a chaotic one, the parent kind of needs to look around and accept some responsibility. And if a parent is drinking too much or got an addiction of their own, unfortunately, it's going to have consequences. And so um, the biggest thing to say there is that if it's a 5-year-old, you're not going to sit them down and talk to them about, well, daddy's got an addiction, and here's all the things to notice and think about. But as they get older, there's a lot of value in sharing enough, right? It's there are developmentally appropriate amounts of things we share, and as with all kinds of things, a parent would choose to share or not share with their children. Like a struggle at their job and stuff. Same idea. You're
Right.
not going to try and complain to them about everything going on. But so with addiction too, one of the beautiful parts of what you can do there is when it's developmentally appropriate, as that child gets older, to say, hey, I think you could tell I've been struggling with this and that. And, here's what I've been trying to do. I don't just give up. Here's what I'm trying to do to get myself better. Things had gone on, well for a period of time. I noticed when, life got hard, or, when I changed jobs, things got worse again, or when we, when your dad and I separated, this and that happened. So just being able to describe enough, not all the nitty gritty and the conversations and blaming and all that, but just describing, here's my journey, and life is hard. I'm working hard at it and trying to get better, and that's kind of what life is. And helping to, to show that child that it's okay to talk about your feelings too, and that, we just try and make ourselves better the next day. So using it, to set an example, and you don't have to be a finished product to do that either. You can still share that you're in a struggle and going on that journey, and to acknowledge that does a lot for the child. It shows the child that you're willing to talk about feelings, you're trying to be a better person,
Mm-hmm.
and that you're sort of giving them permission, to also talk about things, and let you know how they're working on it and what kind of struggles they're running into, and brainstorm together, what to do. So yeah, but of course you do have to be careful about it all, that it's developmentally appropriate.
Yeah, no, I appreciate your your what you just said there, because I think that kids are much more aware of things happening in the household than sometimes parents, when I see them, whether it be, dealing with domestic violence, or, their own addictions, or just, their own mental health. Parents are like, well, I really don't show them these things. But, kids, sometimes can pick up a lot from their environments, and that the nonverbals, just kind of the general mood in the home. And I think it's what you said is a powerful thing. Parents are their kids' first teachers, allowing them to show that, we as parents aren't perfect. And we're working through our own things. We can use that to teach by
Mhm.
example. But then also, that also helps the child understand that, whatever interpretations they may have had of their parents, not blaming themselves for, some things too, is really important as well.
Yeah, a lot of valuable things happen in
Yeah.
that, exactly.
Yeah. Well, so what are some steps a parent can take? And I guess I'm just going to come up with a scenario here, because one of the ones that I hear a lot and is with screen time.
Yeah,
um, I hear this every week by parents who, just because of COVID, we've had to rely more on screens, remote learning, doing more of these kinds of things, and not all screen time is created equal.
yeah.
However, parents, I think, really struggle with, especially if the child has ADHD or autism, depression, maybe. What are some steps that a parent can take if, let's say, for screen time use?
All right, good. Well, let's keep it in the framework that we have already, and
Hmm.
run through this kind of example. So, so imagine your kid's just on it way too much. Again, let's not concern ourselves with exactly how many minutes is bad, or whether this video game versus this app versus this show. Let's just say it's, you get in your gut. This kid's watching too much of this stuff. It's no good. Um, so yeah, rather than just making it about, okay, too much screen time, bad, you're grounded, and that's the whole object, right? We want to help cut through that, look
Right.
at the underlying thing. Okay, let's call him little Jimmy. Little Jimmy, like, I've noticed you're on the screen a lot. So one thing to do, I'll say, is open conversations by pointing out very specific things that are undeniable. So
Mm.
I wouldn't necessarily say, just, you've been on the screen way too much, that's bad. Because, well, what's too much and why is that bad? It's easy for a child to kind of defend against that, or kind of argue with that point in their mind or out
Yep.
loud. um, so instead you want to say, well, I noticed, like, over the last couple of weeks you've been on the screen, from the time you get home until around dinner. That's a lot of time. So we're being specific.
Hmm.
Now there's no argument about, is it, what's too much.
Right.
So we've been specific, and then cut through that, right, and show them that there's something greater that you're trying to work on with them. That's where you're going to get buy-in, is when you show that there's something more to life to be had here. So I noticed, this and that with the screen time, um, but saying at the same time, I don't know if there's something going on that, maybe you're bored, or if there's something going on, at school, that you haven't wanted to see those friends anymore, or is there something I can do to help, get you in more activities, or help come up with some fun things to do at home or whatever, right? So we're cutting through, and it's not just bad screen time. It's let's problem solve together. Like, we notice this, and so let's figure out why you're even doing this to begin with. So they might be depressed, they might just be bored, they might just need help, coming up with creative ideas. They might need mom to push them a little nudge, to go to the neighbors or do something else. Just that push over the edge to sign up for an extracurricular activity. So whatever it is, right? The idea, a whole range of possibilities there, but we're cutting through to show them, okay, let's work through this together and not just make it all about screen time bad. So whatever that is, offering the vision, trying to get buy-in and agreement together on, what constitutes like a really good afternoon after school or on the weekend. So you come home, what, imagine together and dream together, maybe a little bit of screen time. I'm not going to tell parents exactly what amount's right and wrong. I don't know. But let's say it's, 15 minutes to just cool off, watch something, kind of, get home and decompress. But what are we dreaming together, child? Then do you see a friend every day? Is there an activity? Do you practice something you said you like more? Or, what do you read? What does it look like? And that conversation's a lot more fun. There's less arguments, and that's where you're going to get agreement and buy-in.
Yeah. Well, the one pushback that often happens in the clinic when I see this happen is, well, you're on your phone all the time, so I don't understand why you're telling me.
Yeah, and that right there is why parenting is just so special. I mean, in any relationship, and so including kids, our special relationships we really hold dear, where we really respect the other person. That's what's supposed to happen. Is it makes us become our best self, right? We try to fight that current that takes us towards just being lazy or bad or just sloth, right? And because that's what's presented all the time. But instead, it helps us rise up. And so, so that, it's simultaneous, both damn it, kid, you got me. And, but at the same time, thank you, kid, thanks for getting me. Yeah, you're right. And that's back to, like, if you're also suffering with an addiction or depression or just a tough time, back to that same thing, you're right. You're right. Yep. Dad's working on that. And I need to. And you can thank them, for thanks for pointing that out. Now, you don't have to let them be your therapist. There's a boundary there, but just letting them know you're right.
Yeah. I think, again, I thank you for kind of going through that scenario, because it is one that I see a lot. Parents have a lot of questions about, but I can see how this kind of this framework that you presented today can be a really helpful. It can be used for anything, in terms of whether it be alcohol, drugs. Just starting that conversation and giving parents the words in which to do so without getting, resistance immediately, or, kind of being shut out of things. Because we want our parents and kids to be connecting to each other, even during those tough times.
Yeah.
Well, so Daniel, do you have any way for families to reach you? Like, let's say somebody's watching or listening to this and like, I really like what he's saying. Is there any way that they can get a hold of you, or even do any other thing? I know that you had mentioned that you developed an online course. Can you tell us a little bit about that?
Yeah. So if you're interested in exploring, a lot more for yourself, I created something called Self Recovery, and it's at selfrecovery.org. And there's both a full program for the person with an addiction, regardless of the type or the degree. There's people in there that have, heroin addictions, and there's other people who use it for overeating. So it goes through all the underlying drivers and really brings people on a journey to address underlying issues. But there's also on the site, I think it's like at the bottom, you can click courses, And there's also one in there for friends and family. And so if you're a parent and wondering, oh gosh, how do I bring this up? How am I going to talk about it? Kind of questions you're asking, but also just understanding how does addiction even work, and it's such an illogical thing, right? Because
Hmm.
it's doing something that's hurting yourself. So to understand that, understand the science of it, and then the psychology, also how to talk about it, resources. There's what I call a friends and family toolbox,
Mm.
and so there are a couple of ways, and those are meant to be just you know super easy to access tools so that you can get better, without necessarily going to rehab, or without necessarily, if you're not ready for full blown, family therapy and all that. It's a real easy way to just get a ton of tools quickly.
Yeah, well, I love that, and it just is accessible,
Mhm.
and it's private, as you had said, so
Yeah.
you can start anytime, really.
Yeah, yeah.
Yeah,
I just want no barriers. There's less than
yeah,
1% the cost of rehab. It's you just click and you get in, and you just start growing. So
yeah. Well, thank you so much for sharing your time today, your expertise. I really enjoyed this conversation. And like I said, I'll be including all those resources that you just shared in the video description so that if people watch this even a year from now, they can find out more about you and your programs that you offer. Thank you so much.
all right, thanks a lot for having me, Narissa. I enjoyed
Yeah.
it.
Thank you. And so, just so you know, next week's special guest is Dr. Zachary Adams when we talk about teen substance use. So this will continue the conversation, and then I think this conversation with Dr. Hochman was a really nice lead-in to September's book club, which is Conscious Parenting. This is done by Dr. Robert Saul, and it is using the parental awareness threshold. So, how do we make those conscious decisions and those initial interactions with our child so that we can pause and be aware of our own emotions before we start that two-way conversation? And the best part is it's only 76 pages. So, it's a quick and jam packed read this month. So, if you're interested in learning more and reading along with us, please join me in my parenting discussion group on Facebook. All right. Well, thanks again for the show, and we'll see you next week.